John Moore joins us now for more on this. He's a professor of microbiology and immunology at Weill Cornell Medical College. Professor Moore, thank you so much for joining us. So we've come to a sort of tipping point. Private businesses and government officials alike asked people to get vaccinated. Asking didn't quite work enough. In many cases, even bribing wasn't enough to get that percentage of people vaccinated we're looking for. So now we are, seeing the U.S. Army mandate troops get vaccinated in order to serve our country. Is mandating vaccines going to work where everything else has failed?
Well, it will help, but there will still be a large proportion of people who will refuse to take the vaccines under any circumstances. But certainly mandates will increase vaccine uptake to a significant extent, and hopefully enough to get control of the pandemic, because without it, persuasion has not worked. Being nice to people and offering incentives hasn't worked. So we're forced to try something different. And vaccine mandates in the military are new. They've been around since 1775, in fact.
Very good point. I mean, there are all sorts of vaccine mandates that we've all been living with, for generations. So, Professor Moore, what percentage of the population more do we need to see vaccinated to get a handle of this? Are you thinking about 15% more, 20% more? Is there a percentage in mind?
It's hard to put a precise number on this, Tanya. I mean, we're at something like 60% of people have received at least one vaccine, maybe a bit more, one dose of the vaccine, maybe a bit more than that. If you add in people who've recovered and got some degree of immunity, then we're getting up to perhaps 80%. But we've clearly got a large target population of people who are still vulnerable to infection. I mean, it's something best part of 100 million Americans are not vaccinated. Sure, some of them are children that are not eligible yet, but there's still a lot of room for the virus to circulate in and continue to kill people and continue to mutate. And if we don't push that percentage up as much as possible, let's just settle for as much as possible, then we're going to have a really bad winter, because the virus will spread more in the winter, just as it did last winter. So we have to try these additional messages. We just don't have a choice. There's nothing alternative that we can do that hasn't been tried yet.
Yeah, we are at that point. And Professor Moore, you mentioned children. We are seeing a spike in COVID-19 cases in children as kids, of course, return to the classroom. Most people agree children should be in school, but do you think that some of this is coming at their expense?
Well, it's risky for kids and the teachers, and we all accept that there's a degree of risk. And so far, the benefits of in-person schooling have outweighed the infection risk. So mask wearing is essential in schools. None of us in public health and science can understand the furore in the South over mask mandates for children. It's absolutely essential to keep them safe. There are more infections among kids, and some of them are serious, and it is spiking, and it's attributable to both the transmissibility of the Delta variant and the start of in-person schooling again. So we have to do something about this, and of course we're all waiting for the approval of vaccines for the 6 to 12-year-olds. We all want that to happen. We all hope it happens soon, but the safety data is still being reviewed, so it will be a couple of months away yet. In the meantime, teachers all need to be vaccinated, and mask wearing should be absolutely standard in schools. There shouldn't be any debate about this.
I think a lot of people agree with you, Professor, on that one. Now, new cases have surged in recent weeks in certain areas of the country. What additional precautions need to be taken in these areas, or really anywhere, as we head into fall? Because as you pointed out, this colder weather certainly helps the virus.
Well, we saw a surge soon after Thanksgiving, and then a second surge in the Christmas and New Year holiday period. That will happen again. There's no reason to believe anything other than that a highly transmissible virus is circulating. People will travel over Thanksgiving and Christmas. It's inevitable and perfectly understandable. And all of that will increase transmission risks. So what can we do? It's all about getting vaccine uptake, vaccine increases. And there's now serious discussions about putting in place vaccine mandates for domestic travel. If you want to travel from New York to San Francisco, well, you get vaccinated or you rent a car and start driving. It'll take you a long time, but it's your choice. And I think we have to really seriously consider something like this. The Canadians announced a couple of months ago that they're going to do this. So it will happen in Canada, and I think it should happen here. I mean, what else are we going to do? There are going to be another big surge of cases in the travel holiday period, and we have to do something about that.
Professor John Moore, thank you so much for joining us. As always, we appreciate you sharing your expertise with us.
You're welcome.